The overnight ward was still in the way that hospitals are never quite still. Fluorescent light hummed above the corridor on the 4th floor of Calverton General, pressing down on the linoleum in long pale strips, and the air smelled of antiseptic and old coffee, and something sharper underneath both. A clock on the wall read 11 minutes past 2. The corridor was empty, or nearly so, and then Freya Callahan walked into it. She was 34 years old, with dark copper hair pulled tight at the nape of her neck, and gray eyes that were steady in the way a compass needle is steady, not because nothing moves, but because it always knows where it is pointing. She wore navy scrubs and a white badge clipped to her chest pocket, and she carried a chart in both hands the way some people carry things they are genuinely thinking about. She had been on shift for 9 hours. She would be on shift for 3 more. She moved down the corridor past bed 8, past bed 7. She did not stop. Then she stopped. It was not anything she heard. It was nothing she saw. It was something that pressed at the back of her attention the way a song does when you cannot remember the name of it. She turned back and looked at bed 7 through the glass. The man inside was asleep. His name was Calvin Marsh, 61, post-operative, stable. His chart said so. Everything about the room said so. Freya looked at the chart again. Nobody else was in the corridor. The night nurse at the desk 3 rooms down had her head bent over paperwork. A visitor somewhere behind a curtain shifted in a chair. The building breathed and buzzed and did not notice that Freya had not moved in 40 seconds. What nobody there knew was that 3 years before this night, in a place very different from a hospital corridor, a dog had taught Freya to trust the feeling she was having right now. We find something extraordinary here at this channel, and we try to tell it the way it deserves to be told, with care and without hurry. If you are the kind of person who believes that quiet people carry the most important things, then you are exactly who we make these stories for. Subscribe if you want to stay. Now let us go back to the beginning. Calverton was a mid-sized city with a medical district that ran along the east side of the river, and Calverton General sat at the center of it, a 12-story building that had been renovated twice and still smelled like the first decade it was built. The 4th floor was surgical recovery. It was, by the assessment of everyone who worked it, the floor where you needed to pay attention. Freya Callahan had been paying attention there for 6 years. She was the nurse people requested when they were frightened. She was the one who found the chair and pulled it close and sat in it, not for a moment, but for as long as it took. She had the kind of quietness that was not absence. It was presence made so full it did not need to announce itself. She arrived early. She stayed late. She never described either fact as unusual. Her colleague, a fellow nurse named Demi Osei, who had worked beside her for 4 of those 6 years, once said, in the break room, to anyone who would listen, that Freya had a second sense about patients. Not mystical, Demi said, holding her mug with both hands. Just accurate. Freya, hearing this, had looked at her badge and said nothing. She was not decorated on the walls. She did not have a commendation plaque in the hallway. What she had was a reputation that moved through the ward by word of mouth, patient to patient, family member to family member, the kind of trust that is handed between strangers. There was one thing people noticed about Freya that she never explained. When she did rounds in the evening, she paused outside bed 7. Not every night, but on certain nights she would stop there for a moment, look in, and sometimes go on. Sometimes go back. The night nurses knew to watch for it. None of them knew why. Demi had asked her once, "Is it something specific?" "Not really," Freya said. "Is it the patient?" "Sometimes." "So what is it?" Freya looked at the doorway. "It's the room," she said finally. And she smiled, which was the same as saying she was done talking about it. Demi had not pressed, but she had started watching bed 7 too. 3 weeks before the night of the chart, a military working dog unit had held a community access event in the hospital atrium. It was a public relations arrangement organized by the hospital director to support veteran-connected programs in the city. The dog's name was Sergeant Boone, and he was a Belgian Malinois, 5 years old, with a coat the color of dark sand and eyes that moved with the precise and watchful calm of something that takes its work seriously. His handler was a man named Corporal Elio Reyes, 29, quiet in the specific way that military people who have seen a great deal become quiet. He had close-cut dark hair and hands that were always doing something, checking the lead, adjusting the vest, resting flat on his thigh. Boone moved through the atrium that afternoon with a patient, measured stride, alert to everything, distressed by nothing. And then he stopped outside the corridor elevator and would not walk. Not because he was trained to stop there, not because Elio signaled him. He simply stopped, lifted his head, and looked down the hallway toward the fourth-floor stairs. Elio gave the forward signal. Boone sat. A small crowd of visitors and staff had gathered for the event. Several of them were watching now, puzzled. The dog had been impeccable for an hour. He had taken treats from children. He had sat beside a woman in a wheelchair while she wept quietly and nobody knew why she was weeping. He had done every task Elio asked with ease and exactness. He would not move now. "What's happening?" someone in the crowd asked. "I'm not sure," Elio said, low and level. Then the elevator opened and Freya Callahan walked out. Boone rose. He took 3 steps forward and sat again, directly in her path, and looked up at her. She looked down at him. "Hello," she said. He did not break eye contact. The crowd watched. Nobody said a word. The hospital's chief of nursing administration, Director Pauline Straker, was standing to the left of the elevator bank. She had organized the event. She was proud of it. She had not anticipated anything unusual and did not look comfortable with the pause. "Corporal," she said, pleasantly enough, "is he all right?" "He's fine," Elio said. "He's just settled on something." Director Straker looked at Freya. She looked at the dog. Her expression was the expression of someone who runs a schedule and has been informed by events that the schedule is not relevant. "We should probably move along," she said. Freya crouched down slowly, the way someone does who has crouched in front of dogs before. Not tentatively, but fully. Weight settled, eye level dropped. She looked at Boone. He looked back. "What are you telling me?" she said very quietly, more to herself than to the dog. "He doesn't usually do this," Elio said, and there was something careful in the way he said it, something that was not quite surprise. Director Straker watched them for a moment longer. Then she said, with the particular lightness of a person moving something along, "Well, perhaps we should give our staff the room." She smiled in the direction of the crowd. "Sergeant Boone has made a new friend." There was polite laughter. The crowd shifted. Elio gave Boone the release signal, and the dog walked on with his handler, calm and businesslike, and the atrium returned to its ordinary afternoon noise. Freya stayed crouching for a moment after they were gone. She was thinking about bed 7. She stood up and went back to work. Director Straker, in her office the following morning, mentioned the incident to her deputy in a way that was not quite a complaint. She said it had looked odd. She said that Nurse Callahan had seemed uncertain how to move the situation along. She did not use the word professional. She did not need to. The deputy, a man named Gordon Hayes, who tracked performance reviews, wrote something in a notebook. What nobody on the administrative floor knew was what the dog had recognized. And what nobody anywhere yet understood was what the chart in bed 7 had not yet said. The reassignment came on a Tuesday. Freya heard about it the way most things travel in a hospital, through Demi, in the break room, before rounds. "They're moving you," Demi said. She was standing very still. "To where?" "Discharge administration. For the next month." Demi set her mug down. Gordon Hayes put in the order. He said they need experienced nursing input on discharge coordination. Freya looked at the table. That's not a nursing role, Demi said. It's adjacent. It's paperwork. It's a desk with a window that faces the parking structure. Freya was quiet. You've been on this floor for 6 years, Demi said. You know every patient's name. You know which rooms run cold. You know when something is wrong before the monitors do, and they're putting you in a room with a parking structure view. Maybe they need the input, Freya said. Freya, I don't know what he knows and what he doesn't know, Freya said. And I'm not going to assume. She picked up her mug. I'm going to finish rounds. Demi watched her go. She picked up her own mug, set it back down without drinking from it, and said to the empty break room, in a very low voice, "That is not all right." Freya spent her last week on the 4th floor doing what she had always done. She arrived early. She stayed late. She did her rounds with the same attention she had given every round for 6 years. She sat in the chair beside Mrs. Henriksen in bed 3 until Mrs. Henriksen stopped crying. She found the blanket that Mr. Alonso in bed 10 needed and could not ask for. She stood in the doorway of bed 7 on 3 separate evenings and looked at the chart. Calvin Marsh, 61, post-operative, stable. She looked at the chart. She looked at the man. She went on. On her last shift before the reassignment, Demi walked with her to the elevator. You could say something, Demi said. To who? Director Straker, Gordon Hayes, someone. About what? About the fact that you belong here. Freya pressed the elevator button. Everyone belongs somewhere, she said. I'll be fine where they put me. The elevator opened. She stepped in. Demi stood at the threshold for a moment. What is it about bed 7? She said. The doors were already closing. I don't know yet, Freya said. The discharge administration office had a window. Demi had been right about the parking structure. Freya put a small plant on the sill on her second day, a trailing green thing she bought at the hospital gift shop for $4, because the room needed something living in it, and she was going to be there for a month, and she did not see the point of enduring a room that had nothing alive in it. She did her work thoroughly. She always did. She made the discharge documents clear and correct. She called the follow-up coordinators when the notes were incomplete. She flagged 3 errors in the system that week that would have resulted in incorrect medications reaching patients. No one mentioned that she had flagged them. She did not go back to the 4th floor. She thought about Calvin Marsh. She thought about the chart. Post-operative, stable. 2 days post-op, his oxygen saturation was 96%, which was fine. His pain scores were reported as low. His vitals were logged every 4 hours. She thought about the thing the chart was not saying. On the 8th day of her reassignment, the military working dog unit returned to the hospital. It was another community visit, a different ward this time. Freya did not know about it until she stepped out of the elevator on the 2nd floor to deliver a file and found Boone sitting in the corridor outside the physical therapy wing. He was sitting the way he had sat before, calm, watchful, looking at her. She stopped. Elio was 6 feet behind him. He looked at Freya. He looked at his dog. He did it again, Elio said. He did, Freya said. They stood in the corridor, and neither of them said anything for a moment. He does this with certain people, Elio said. He's trained in medical alert support as a secondary certification. He usually works detection and patrol, but he was also trained for a year alongside medical alert service dogs. He paused. He doesn't use it often. Freya looked at Boone. What does it mean, she said, when he does this? Elio looked at her steadily. It means, he said, that he thinks someone needs to pay attention. Freya was quiet for a long time. Then she said, I need to go to the 4th floor. She went back to the fourth floor that afternoon, on the pretext of retrieving an old file. She went to bed 7. The man in the bed was different now, a new patient, and Calvin Marsh had been moved to a step-down room on the 3rd floor. She found the nurse on duty, a young man named Peter, and asked if she could see the transfer chart. He handed it over without thinking. She read it. His oxygen saturation at the time of transfer had been 94%. Not alarming, perfectly within accepted parameters. His pain scores were still low. She read the note from 3 days ago. She read it again. She felt the thing at the back of her attention become very loud. She handed the chart back to Peter. She thanked him. She walked out of the 4th floor corridor and took the stairs down to the 3rd floor and found the step-down room and opened the door. Calvin Marsh was awake. He was sitting up. He looked at her the way patients look at nurses who come in without being called, with a mixture of reassurance and mild alarm. "I'm Freya," she said. "I used to do rounds up on 4. "I remember you," he said. She pulled the chair over and sat down. "Tell me about your breathing," she said. He told her. She listened. She asked him to take 3 slow breaths, and she watched his chest. She saw it. She did not say anything. She stood up and found the on-duty doctor, Dr. Amara Osei, who was Demi's cousin and who had worked at Calverton General for 12 years. She told Dr. Osei what she had observed, calmly and specifically. She described the chart note. She described the breathing pattern. Dr. Osei came to the room within 4 minutes. 45 minutes later, Calvin Marsh had a new diagnosis. A pulmonary embolism, small but real, caught before it became something else. The doctor found Freya in the corridor. "How did you know?" she said. Freya looked at the floor for a moment. "I've been thinking about his chart for 2 weeks, she said. Dr. Osei looked at her. "You've been in discharge administration for 2 weeks." "Yes." Dr. Osei was quiet. Then she said, "I need to ask you something." Freya waited. "Were you ever at the Mitchell Institute?" The corridor was lit by the long afternoon light that came through the windows at the far end, warm and very still. A cart rolled somewhere distant. A door closed. The building breathed. Freya looked at Dr. Osei. She did not answer right away. "Yes," she said, "for 3 years." Dr. Osei nodded slowly. She looked at the door of Calvin Marsh's room. She looked at the chart in her hands. Then she looked at Freya, and her face had changed in the way a face changes when a question that has been formless finally gets its name. "I trained there," Dr. Osei said, "for 4 months, before the program closed." Freya nodded. "They had a dog there," Dr. Osei said, "a German shepherd named Petra. She worked alongside the diagnostic team." She paused. She had a way of stopping at certain beds. Freya did not say anything. "They called it pattern recognition," Dr. Osei said. What she was doing with the nurses she worked alongside. What she was training them to notice. Silence. "The nurses who trained with Petra," Dr. Osei said, "they used to talk about her the same way. They said it wasn't that she found the patient. They said she found the gap, the thing the chart wasn't saying." Freya looked at the wall. "Boone," Dr. Osei said quietly. "The dog downstairs." "Yes." He knew. "He recognized something," Freya said. "I don't know what exactly." "I do," Dr. Osei said. The corridor was very quiet now. It was the quiet that happens when a few people in a hallway all stop moving at the same moment. Not because they agreed to, but because something in the air has weight. There were 3 other staff members visible at the far end. None of them had heard the conversation, but all of them had gone still. Dr. Osei said, in a lower voice, "I want to tell you something." "All right," Freya said. "The Mitchell Institute's clinical observation program," she said, "produced 16 nurses in 3 years. I have met 4 of them. Every single one of them has caught something that the standard protocol missed. Freya was quiet. Every one, Dr. Osei said again. Demi had arrived at the third-floor nurses' station at the end of her shift, looking for a form, and had stopped when she saw Freya in the corridor with Dr. Osei. She was close enough to hear some of it, not all of it, but enough. She stood by the station desk and held her form and listened. Director Straker had come down to the third floor on a separate errand, and was visible at the far end of the corridor, beside the supply room door, when Dr. Osei raised her voice slightly for what she said next. "You should not be in discharge administration," Dr. Osei said. "You should be exactly where you were," Freya said. "That's a kind thing to say." Dr. Osei said, "It's not kind, it's an assessment." She turned and walked to the nurses' station, where she made 3 phone calls in the space of 12 minutes. The first was to the floor supervisor on 4. The second was to the hospital's chief medical officer. The third, Demi noticed, was short, and the doctor's voice was very calm and very clear. Gordon Hayes appeared on the third floor 20 minutes after that. He stood in the corridor near the supply room. He looked at Freya. He looked at Dr. Osei. He said very little. He was last seen walking toward the elevator, and he looked, more than anything else, like a man who was rearranging something in his head. Director Straker stood a little longer. Then she walked to Freya and said, quietly enough that it was only for Freya, "I owe you a conversation. I think we both know that." She did not wait for an answer. She walked on. Nobody photographed the moment. Nobody announced it. It happened in a corridor under afternoon light, in plain view of a nursing station and a few staff members who happened to be present. And it happened the way real things often happen, not with ceremony, but with a kind of settled weight that everyone who was there would remember. Freya was back on the 4th floor by the following week. She spoke about the Mitchell Institute only once, in a brief conversation with Dr. Osei and Demi, in the break room, after a long shift, when Demi asked directly. She told them about the year of clinical observation training. She told them about Petra, the German shepherd, who had worked alongside the diagnostic teams and taught an entire cohort of nurses how to find what the chart left out. She told them about the patients. 3 of them, she said, had been turning points for her. A woman with a pain score of 2 who was in crisis. A man whose oxygen readings were fine and whose lips were blue. A teenager whose chart said stable, and who, an hour later, was not. Petra didn't diagnose, Freya said. She interrupted. She stopped and made you stop and look again, and over time you started to do it without her. Demi wiped her eye with the back of her wrist. "You didn't tell anyone," Demi said. "There wasn't a reason to," Freya said. "The work is the work." "Freya, I just pay attention," Freya said. "That's the whole of it." Dr. Osei had one more thing to add. She said it quietly, looking at her coffee cup. She said that when the Mitchell program was evaluated before it closed, the Institute's lead researcher had written in the final report that the nurses trained alongside Petra had an anomalous rate of early clinical catch, measured across 5 years of follow-up. The researcher had called it, in the formal language of the report, a pattern of sustained attentiveness that current training models did not produce. In plain terms, Dr. Osei said, looking up, it means you were trained to notice in a way that most people are not. There was no applause. There was the small sound of a chair being shifted and the distant hum of the building. Demi reached across the table and put her hand over Freya's hand and said nothing, because there was nothing to say that would be more. Boone came back to Calverton General one more time that month for a 3rd community visit. When the elevator opened on the 4th floor, he walked out of it ahead of Elio, moved down the corridor, and stopped outside the nurses' station where Freya was writing notes. He sat down. He looked at her. She looked up. "Nothing to tell me tonight?" she said. He put his chin on the edge of the desk. The other nurses laughed. Elio, from the elevator, shook his head slowly. "He doesn't do that with desks," he said. "He really doesn't." Boone remained where he was, entirely at ease, entirely decided. The visits became regular. Twice a month, the working dog unit came to the 4th floor as part of their Calverton circuit. Boone worked the ward the way he worked every environment, alert, calm, purposeful, and he always ended the visit at the nurses' station. It became the thing on the 4th floor that people looked forward to. The patients knew about it. Some of them asked, on their first day, when the dog was coming. A girl named Rosa, who was 7 years old and was visiting her grandfather in bed 6 on a Thursday afternoon 6 weeks after Calvin Marsh's diagnosis, watched Boone sit down beside Freya's chair and put his chin on her knee. Rosa looked at her mother, then at the dog, then at Freya. "Why does he always do that?" she asked. Freya looked at her. An older nurse named Billy Sato, who had been on the floor for 19 years and had seen most things, looked over from the supply cart. "Because," Billy said, "some people know how to pay attention, and animals always notice." Rosa thought about this with the seriousness of someone who is going to remember it. Elio looked at Freya. Freya looked at Boone. The dog did not look up. He was already settled. 3 months after the night of the chart, a small wooden sign appeared at the nurses' station on the 4th floor. No one was entirely sure who had put it there. It had been routed through the hospital gift shop, special order. It was plain pine, the size of a paperback book, and it said, in letters that were not decorative, only clear, "Pay attention. Someone already is." Freya never asked about the sign. She did not claim it and did not deny it. She worked around it the way she worked around everything that mattered, steadily, without announcement, with the particular kind of quiet that had always been the most accurate thing about her. Boone came back on the 2nd Tuesday of the following month. He walked through the ward, steady and alert, his paws soft on the linoleum. He moved past bed 8, past bed 6, past bed 3. He stopped at the nurses' station. He looked at Freya. She looked back. The fluorescent light hummed above them, pressing down in long pale strips, the same as it had always been, and Freya was at her desk with a chart in both hands, the way she held charts when she was genuinely thinking about them. Nothing had changed. Everything had. If you have ever known someone who worked quietly and thoroughly and did not ask to be seen, who showed up early and stayed late and never told you what they had learned or where they had been, this story is for them. We believe that the most important people in any room are often the quietest ones. Tell us in the comments about a moment when someone paid attention and it mattered. We read every single one, and if you want more stories like this one, subscribe. You belong here.